Distinguished Madam Anne Johansen, representative and head of the WHO office to Skopje. Distinguished Madam Jerry Dybel, representative of the USAID office. Dear representatives of the diplomatic corps, dear colleagues, dear guests. Welcome to today's event, which will present the key achievements from the two projects that the WHO implemented in partnership with the Ministry of Health over the past year and with the support of the United States Development Agency, USAID. The introductory video showed us some of the activities within the project, such as building preparedness and response to emergency situations, response capacities of the healthcare system on the one side, and the preparedness for applying COVID-19 vaccines, which has the purpose of strengthening the efficiency of the public healthcare network, including of the Epidemiology Center for Management of Healthcare Crisis. Also to strengthen the capacity of the healthcare system so that it could respond to the broader healthcare needs, including mental health. Additionally, to develop the laboratory network of the public healthcare system and to support better coverage and safe application of the COVID-19 vaccines. In addition to the WHO support, the achievements within projects were made possible with active participation of many national institutions and professional associations. Therefore, we are here to extend our gratitude to the Ministry of Health, Public Health Institute, Centers for Public Health, Faculty of Medicine in Skopje, Infective Diseases and Febrile Situations Clinic, Epidemiology Institute, Crisis Management Center, Institute for Earthquake and Seismic Engineering, as well as associations of family medicine doctors, private doctors from primary health care, medical nurses and obstetricians, and the dentists. Gratitude goes also to the Family Medicine Center, COVID-19 centers, clinical dentistry center, and general hospitals, medical centers, team Institute for Qualitative and Quantitative Researches, associations of citizens BIOM and Romalitico, the Red Cross, and to all healthcare workers who made their individual contributions to the implementation of activities. We thank them. Today, we will have the opportunity to hear from many important professionals in the healthcare sector who will discuss the achievements and their significance towards strengthening the COVID-19 response, and also the next steps related to these activities. But in the beginning, let us see the video address of Dr. Bekim Sari, Health Minister. Dear Dr. Anne Johansen, a representative of WHO in the Republic of North Macedonia, dear Madam Jerry Dybel, representative of the USAID in the country, dear partners, colleagues, friends. It is an honor and a pleasure for me to address you in today's meeting where we are celebrating the successes we achieved within the WHO project, strengthening the healthcare system for emergency situation response and COVID-19 vaccination, supported by the United States International Development Agency, USAID. Allow me to use this opportunity and extend my sincere gratitude to the WHO for the successful implementation of projects. Also, huge gratitude goes to USAID for the support they gave us towards strengthening of the healthcare system, not only through these individual projects, but in continuity since the beginning of the COVID-19 pandemic. The COVID-19 pandemic is a global challenge that put to a test healthcare systems around the globe and also had a huge impact on our healthcare sector. The Ministry of Health closely cooperated with the WHO and other international partners so that we could deal with COVID-19 more successfully, to also provide socioeconomic recovery from the pandemic and to improve the results from healthcare institutions for the people in the country. Activities of the project helped us immensely to lead strategically the interventions on combating COVID-19, on safe procurement of vaccines, on providing necessary skills for the workers in the healthcare sector, and also to use behavioral data for positive involvement in the community and to increase the trust in the process of COVID-19 vaccination. The important results achieved in a space of only a year, and you will hear more about them today, demonstrate that cooperation and partnership are very important in dealing with the current situation caused by COVID-19, but also to set strong foundations for future emergency situations, where the focus will be on patients who will be able to swiftly notice the differences in the healthcare services they receive. We will continue working together to apply prudently the lessons learned from these two projects, and we will take all necessary steps to make sure that the structures and services are sustainable and they contribute towards even stronger healthcare sector. And in the end, the achievements from these two projects will be our support, our basis for setting priorities for the 20-year development strategy for the Republic of North Macedonia 2022-2042, which is in development at the moment. I wish you a successful working day, and I thank you for your attention. Now we will hear the speech of Dr. Anna Johansson, representative and head of the WHO in Skopje. You can take the floor.
Thank you so much. Excuse me. Dear representatives of the Ministry of Health, Ms. Jerry Dibble, the country representative of USAID, dear representatives of the UN family, healthcare professionals, NGO representatives, partners, guests, everyone who has been part of this really important effort. And I want to echo the previous speakers that this has been a true teamwork effort, and it could not have been done without that. And even though I don't feel that I personally could take any credit for it, I have to say I'm really proud, not only of my own team, the UN family, but really of North Macedonia. I always tell people when colleagues outside I meet, I say North Macedonia is the best place to work. Not only is the Minister of Health really supportive of everything we do, he wants the right thing for the population, for the healthcare workers, but there are so many good professionals. What we really lack normally is an institutional setup, a system that really promotes this. And I think what's been really unique about this project, or these two projects, has been that it hasn't just focused on emergency supplies. Yes, there's been some of that, but what it has really focused on is building institutional capacity during an emergency for equipping North Macedonia to really be better equipped to address future pandemics. And I think this is very unique. And I have been telling my colleagues in WHO that they need to look at North Macedonia's experience, because this isn't being replicated elsewhere. And you saw one video, but we've actually produced 4 or 5 of them. And I'm going to a global management meeting where all the WRs from the whole world with senior management are coming together. And we're each showcasing different aspects of what we do, and we are going to be showcasing these videos because they are truly unique, and you should feel incredibly proud. You will hear many times today all of the things that we have done with the help support of USAID, and I cannot thank Jerry and all of her organization for the incredible opportunities that you have afforded us and North Macedonia, more importantly, during this time, because we could not have done any of this. So you really contributed in a way that you will see the impact of for many years to come. With your contributions, we have been able to design, monitor, and adjust the COVID-19 response interventions. And I think this is really critical because it's a model of how the health system should work. It should, the Ministry of Health and its relevant associated agency monitor what's going on. It should use data to analyze the situation and take corrective action. And I keep telling everyone, those of you who know me, is this is the most essential function of the Ministry of Health, and it is not generally being done. And here is the exact example of how this should be done. And so we can learn, not only for future pandemic and emergency purposes, but for the health system. What needs to be done? How do we need to do things? We have bolstered, in addition to the other interventions, the vaccine cold chain, surveillance, and contact tracing, traditional public health functions that in many countries have gone a bit by the wayside because of the pressures of other aspects of the health system and sometimes cost pressures. This is not unique to North Macedonia. If you see high-income countries like the UK, you have seen the impact of that. My own country, Denmark, we've also seen this. And in fact, the last pandemic preparedness plan that was developed was approved on the condition from the government that it not cost anything. Well, you can well imagine that it wasn't very effective. We've also been able to roll out COVID-19 vaccinations to protect communities, and we all know that's been a particular challenge here, but there's been very innovative efforts to try to address this. The vaccine caravans that you saw some of the pictures here from have turned out to be quite effective and very cost effective, which is a very important piece of evidence, again, serving other countries. And we've used evidence-based data and insights to fight misinformation and create favorable community engagement to increase the trust in the COVID-19 vaccination process. And I think this issue of trust is really critical because when we do surveys of why people don't use primary health care, why people go to private practitioners, it's because they don't have trust in the services provided in the public sector. And so this is another lesson that we need to take forward, that if we are going to improve utilization of public health, we not only have to improve the quality of the services, but we have to show the population that they can trust what is being provided. And that's not an easy thing. And part of the information we've gotten is from the Behavioral and Cultural Insights Surveys, which is a new initiative of our regional director for WHO Europe, that in order to do a better job, we need not only quantitative data about numbers and rates of infections, etc., but we also need to understand what motivates people to pursue certain behaviors. And again, North Macedonia has really been a pioneer country in fielding, I think it's 4 of them altogether, and we're now planning greater use of these surveys in our initiatives going forward, not just for COVID. So again, this project, or these projects, have really been essential in testing out new approaches that can be used beyond the COVID pandemic. It was a very difficult project to implement. And in fact, when I first got here, I thought, and I looked at this and I thought, I'm not sure this can be done. But the team in my office assured me that they had a plan, that they had really good partners, and essentially I should just let them do their work. So initially, I tried to come up with a few suggestions, and they said, we've already thought about that. And some things, this is not the time to do it. So I decided, okay, clearly these are people who understand the situation, and clearly they have really good partners. So my job is to pave the way and support their work, just as they have supported the people, the partners they have worked with. As a result, with the COVID-19 changing so rapidly and with new evidence coming on board, we've had to develop modalities and training modules to equip the healthcare workers with better understanding, better knowledge, and new skills. And we've also had to provide much needed equipment to healthcare facilities, particularly the public health laboratories, and equip equip the public health emergency operations centers. And again, we could not have done this without USAID's support. Talking about the functionalities of the public health emergency operations centers, we've managed to strengthen the system's ability to detect and respond to any emergency. We have reinforced the country's overall health security system. And what I have found particularly impressive is that the public health emergency operations system is not just one center, but that it has regional centers and that they're linked. So it's really like a hub and spokes system. And this is quite unique, because while other countries might have regional public health centers, they're actually not connected. So they don't have the sharing of information that goes on. They don't have common analysis of data, and the command chain doesn't exist. So this is really a very wonderful invention. Although one shouldn't think that it was necessary because it seems obvious, but sometimes what seems obvious to outsiders may not have happened because of legacies from previous systems. The Public Health Emergency Operations Center has allowed us, or allowed the system, to really address emergent challenges. And the challenge now is that COVID may seem like it's over, but the consequences of COVID are not over. We see that many people suffer from long COVID. In fact, I have a sister who, a year later, who was a consultant physician in the UK, has had to quit her job because she suffers. Now, luckily, the evidence, the most recent evidence based on the last several years of COVID shows that it's only about 4 or 5% that has this still ongoing long COVID, but that in fact 30 to 40% of people with COVID have several months of impacts. They can't put a number on it, but this is a pretty significant number of people, and anyone here who's had COVID may have gone through a process where they are fatigued for months on end, or they lost their sense of smell, and that it took a long time to come back. The other major impact of the COVID pandemic that we are suffering from today is on mental health. So many people were negatively impacted that both rates of suicide, depression, anxiety, etc., still are affected and has gone up, presenting a really big challenge for the health system, because this is not something that most health systems, including in North Macedonia, were well equipped to address. And it's particularly important for child and adolescent population groups who have suffered disproportionately, as we have seen. In the country that I come from, Denmark, we have done surveys every quarter throughout the whole pandemic, and what we're seeing is about 60% of adolescents have mental health problems, and many of them are continuing. And the interesting part is this doesn't vary from those people who had COVID and those who didn't. So this is something that's affecting everyone. We will, in the coming year, with partners, start focusing on training mental health providers, alerting and building awareness on part of parents, as well as healthcare providers, psychologists, about this issue as a first step towards really developing mental health services for children and particularly adolescents. And something that we are now seeing increasing evidence for, it may lie beyond the health sector, but I want to highlight here as well, is that we're seeing this generation of adolescents and children having lost at least a whole year of schooling. So they're set behind a whole year. And the society will suffer from this unless something is being done about it for generations to come. So there are really a lot of challenges that need to be addressed. And hopefully, together, we can continue with addressing these things and building back better, because having well-functioning health systems that address the burden of disease really does save lives. And I want, in closing, to really thank everyone here who has made this project a success. And I hope that we can continue to work together on learning from the very positive experiences that have been focused on the COVID pandemic, expanding them to the health systems at large so that we can continue to address the consequences of the pandemic. Thank you so much.
Благодарим на доктор.
Thank you, Dr. Johansen, for your address. Now we will hear from Madam Jerry Dybel, representative of the USAID office.
Good morning, everyone. It's a pleasure to be here with all of you, colleagues, friends. I am pleased to join WHO today to celebrate the accomplishments of our recent partnership. The partnership also included the Faculty of Epidemiology, the Faculty of Medicine Public Health Division, civil society, including many of you here with us today. You have committed yourselves to supporting new initiatives and collaborating to build a resilient and sustainable healthcare system, which is imperative for the country's present battle against the COVID-19 pandemic, as well as future challenges in public health. Since the beginning of the pandemic, USAID has assisted national health authorities in North Macedonia to design, monitor, and adjust COVID-19 response interventions. By supporting the immunization cold chain and the digitalization of the vaccination system, we have ensured that COVID-19 vaccines have been safely delivered to those who need them the most. We also helped address shortages of medical equipment and supplies that were crucial for the work of frontline healthcare workers. But with every health threat, COVID-19 has revealed gaps in healthcare systems for responding to such a public health crisis. It forced us to recognize the preparedness as one of the most important aspects for an effective response to any kind of health emergency. Therefore, we are proud to have supported the Ministry of Health and WHO to strengthen North Macedonia's health system emergency preparedness and response capacity. Together, we have developed the Public Health Laboratory Network and strengthened the Public Health Emergency Operations Center, enabling their strategic and efficient coordination and management of resources. Even though the pandemic is changing, it is still not over. And while COVID-19 has been a very pressing emergency health challenge, it will not be the last. We cannot afford to let our guard down and put at risk the progress we've made in addressing this grave health threat. Now is the critical time to ensure that we are even better prepared for the future, using what we have already learned through the last 3 years. With the commitment of the Ministry of Health and WHO, we will continue building the overall health system's capacity, both to address the current pandemic and for future emergencies in the years to come. In the coming months, we will work together to strengthen health policy, bolster the Agency for Medicines and Medical Devices, and continue supporting COVID-19 vaccine readiness and deployment in North Macedonia. Despite all these efforts that we've talked about today, a large percentage of the population remains unvaccinated. Further worrying is that this country is experiencing a decrease in vaccination rates for routine pediatric vaccinations. I personally am worried about a measles outbreak or polio or other threats that we had thought were no longer something that we needed to worry about. USAID remains committed to supporting North Macedonia to work through these challenges. We will work with our partners to uncover barriers to vaccine uptake, such as disinformation and the need for fact-based reporting around public health. While it's important to take this time today to reflect on the important accomplishments we have achieved since the beginning of the COVID-19 pandemic, I would also like to challenge all of you to strive for new ways to overcome vaccine hesitancy. I would welcome setting up a meeting and talking about what we could do, what your ideas are, because I think this is a challenge that we're facing not only in this country, but globally, and we don't have the right tools in place or the right ideas to really address it effectively. So thank you for your involvement in this project. I look forward to working with all of you and continuing to partner in the future. Thank you.
We thank Madam Dijbel for her address. And before we continue with the first panel for today, let us watch another video on the activities to establish the Center for Epidemiology Traces and Health Crisis Management as an introduction to the next topic.
Timely information sharing, strategic coordination, and efficient management of resources are all critical elements for an effective response to public health emergencies such as COVID-19. Having a central hub for collecting information, making decisions on priorities, and coordinating action and communication can help countries to better direct emergency operations and save lives. WHO is proud to support strengthening North Macedonia's emergency preparedness and establishing this center.
Особено сум среќна што Министерството за здравство во 2020
I'm very happy that the Ministry of Health in 2020, at the very beginning of the pandemic, recognized the need of a center.
И почнавме со процесот на формирање на мрежата и центрите за брз одговор.
На почетокот на пандемијата, координацијата беше голем предизвик. Постојано имаше нови информации, а и самата ситуација се менуваше рапидно. Со востапување на овој центар се овозможи надзор во реално време на случувањата во сите региони во државата и непрекината, брзо размена на информации.
Undoubtedly, there will be other emergencies with health consequences. And the steps that have been taken over the last 3 days will certainly help the response to be much more effective and efficient.
Епидемиолошкиот оперативен центар во Скопје ни возможува брза координација со 10 центри за јавно здравје низ државата, како и размена на информации и мониторинг во реално време. На ова место, меѓу вработените се собираат, анализираат и евалуираат постигнати податоци и врз основа на тоа се изготвуваат соодветни препораки за брзо дејствување во случај на јавноздравствени кризи.
Постојано ги градевме и се уште континуирано работиме да ги градиме капацитетите, пред се човечките капацитети, значи човечките ресурси, користењето на иновативни алатки за навремено следење и надзор на заразните болести е приоритет во епидемиолошкиот центар за следење.
Јас сум навистина горд што денес имаме еден современ опремен центар со соодветен обучен кадар за брз одговор при итни ситуации состојби.
Ključot na uspehot.
The key for success lies in the dedication to our work and the resolve to do our best for preparedness and response to COVID-19. Now we will have the expert panel discussing the effectiveness of healthcare capacities for prevention, detection, control, and response to COVID-19 and other pandemics. It is an honor to invite the moderator of the panel, Mr. Tanas Goga, an expert in the area of risk communication from the regional WHO hub on response to emergency situations in Belgrade, as well as the panelists. Dr. Žarko Karadžovski, coordinator of the epidemiological tracing and management of healthcare crisis, Dr. Milena Stevanovic, infectology specialist from the Clinic on Infective Diseases, Professor Golubinka Boshevska, microbiologist and expert for laboratories in the Public Health Institute, and Dozen Stoyan Bayraktarov, president of the Mental Health Committee in the Ministry of Health. You can take the floor.
Good morning, everyone. It's really an honor and a privilege to be here in front of this distinguished audience and key stakeholders for public health in North Macedonia, and also to moderate this panel of distinguished health experts on how to strengthen the country's capacity to respond better to COVID-19 and other health emergencies. Working for providing and also maintaining a safe world and protecting the vulnerable citizens is among the top priorities for the WHO Health Emergencies Program. And our goal in this program is to ensure that the world is better prepared for health emergencies, COVID-19, and also what is the mounting and often overlapping ongoing health emergencies that we are going through nowadays. The work of the WHE health program is all-encompassing. It touches upon all aspects of the health system, like from research and potential threat assessments to prevention and management of epidemic and pandemic diseases, through strengthening and expanding the rapid detection and, of course, diagnostic systems to patient management and care. And to talk about the North Macedonian experience on expanding the health systems to rapidly detect, investigate, and assess potential threats to public health, and of course to respond immediately and systematically to manage acute emergencies, such as the COVID-19, but with a special focus on the act of the Emergency Operational Center. Now I'd like to give the floor to Primarius Dr. Žarko Karadžovski from the Institute of Public Health. Please, Dr. Žarko, the floor is yours.
Thank you. Малко ми изгледа.
This seems to me a little bit like police. Sorry that I will have to stand like this because the light bothers me. I'll begin this with a conclusion that I've gathered from 30 years experience. Contagious diseases, due to their microbiological, sociological, and other impacts, and given the fact that we have increased AMR, and due to the fact of some forgotten and newly emerged contagious diseases, and because of tourism and trade increase, will always be, as they have been, a huge health impact. Knowing all that, I'll continue with the COVID-19 pandemic. Not because other contagious diseases I have forgotten. In 30 years of experience, I've seen everything in this country, and I expect that some bit forgotten diseases, or those that we still don't have enough awareness, that will appear, like morbilli, parotitis, mumps, rubella. Why? Because vaccination coverage has dropped. And that's going to be something I'm gonna call upon not to happen. The COVID-19 pandemic has undoubtedly left strong traces in the world's history, as both in historiography and medicine. Many healthcare systems around the world were disorganized or destabilized, to say the least. Even the rich countries were faced with something for which, after 2 years of history that I have been relentlessly following these 2 years, I realized that there were even worse and better facings with this situation. However, this destabilization of the health system and the emergence of the corona epidemic created from its own side a dramatic message for the world that where health of the population is jeopardized and where it's about life of people, there is no higher priority than that priority. We can be talking about political systems, economic development, about something that can wait, but health of the people cannot wait. And all the efforts of the WHO, of our partners like USAID and other partners and other countries, partnering countries from the EU, have demonstrated that preventing bad measures can help a lot. WHO has a global system for surveillance of infectious diseases 24/7. Based on information collected and based on analysis made, they produce recommendations or guidance or guidelines that we get in terms of documents, written documents or online documents. Based on all that, even though it was we had the epidemic of corona in the country, we had to think about a higher goal. In August 2020, with the biggest surplus of corona in our country, at a time when we had the British and the Delta variants, we were faced with two challenges. First, how to strengthen our healthcare system even though the whole government was dedicated to it. But we did the only step that at that time was priority, and it was to strengthen the healthcare system. To this end, we established this emergency operational center for health emergencies in order to respond to all possible challenges that could show up. So this center was established. It is a central hub where epidemiological data is collected, where field data is collected, and at the same time we follow worldwide sites. You could see the big TV screen, and in front of it there are people who follow ECDC, CDC, WHO, and other sources with their websites to be able to download documents that are of vital importance. When faced with such a challenge, somebody called me as head of the center, that something is happening at the moment. Based on that call, I convene. Now I'm describing to you the system of functioning. They collect information, they evaluate information, and on the basis of that, this information is distributed then to the Minister of Health and to the government institution. Isn't this epidemiological surveillance, collecting, processing, analysis, and dissemination to the institutions? That's a real epidemiological surveillance. We do have the space, capacities, tests, reagents, information center, IT system that we are trying to make it as it should. We know from the past that this was done on a paper-based way. Now we are doing it online. With the help of USAID funds, and many thanks also to WHO, which managed to help us with the crisis and with the establishment of this center. A second big characteristic of another success is the alert system 2, for online and daily basis information creation based on the situation we have in the country. It's great that we managed to connect the regions for internet, intranet links with the colleagues from the Centers for Public Health. We trained them. You could see Mr. Paul Cox, where we collected the information at one place, distributed to the colleagues in the countryside, and in that way we became ready for any further challenge or risk. Our operations center can only be upgraded and survive in the future.
Thank you so much, Dr. Karachowski, for a very interesting and informative discussion. Now I'd like to give the floor to Dr. Milena Stefanovic to talk about a little bit on the focus on the clinical management of COVID-19. Please, Doctor, the floor is yours.
Thank you. You could not expect us to say within few minutes everything that we faced, emotions, practice, lessons learned. I will try and be a bit more concise. First, I thank you for the honor of featuring me within this podium. I do not feel, as I'm interrogated, I feel like I'm taking the stage in a fashion show. I feel, well, I thank you for giving me the honor of speaking on behalf of the entire team that managed the situation with COVID. I can see Professor Kalina Sardelova, Director of the Gastroenterohepatology Clinic, President of the Medical Chamber. Professor Dokic is not in this room, but many of us wearing white coats, managing hospitals, managed overnight to respond flexibly, efficiently, to leave their ordinary stations and be seconded to the COVID hospitals. Now, looking at this from a distance, This was also under serious leadership of the then minister, Dr. Venko Filipče, and also with important partnership with outstanding support of the WHO, the UN family, and the USAID in the country. So I believe that we managed to do our best. If that had not been the case, I believe it would have been much more painful, much more tragic to live with COVID-19 in the past years. In addition to the testing, surveillance, and also tracing patients, the main concern was to provide them healthcare in outpatient and inpatient hospitals, to find and use every bed available, which required rapid and dynamic communication with every doctor. In the infectious diseases clinic, but also soon afterwards, it encompassed all healthcare institutions around the country. The concern was to protect the healthcare workers so that we do not have victims amongst the healthcare workers, and to provide maximum of care for every patient. And this necessitated provision of protective equipment, which it was not easy to find it during that time, to make a quick assessment about the needs, quantities, and qualities of such equipment. But thanks to the WHO and their rapid response, we received this in continuity, and we had sufficient quantity of equipment for all healthcare departments that treated COVID-19. On the other hand, it was not enough to have the personal protective equipment. It was necessary to know how to use it, how to remove it so that it is not a secondary source of infections. It was necessary to apply every new knowledge acquired in the actual treatment of COVID-19, and for this it was necessary to learn. When you have more than 150 daily examinations in your hospital, where all your beds are occupied by patients in critical situations, it is very difficult to learn to read, but the access to webinars, to concise knowledge, provision of recommendations from one strain to another, the experiences changed. It was something that was necessary for quality, for up-to-date treatment of patients. And thanks to the WHO, we not only wrote the updated information, they were provided by them, but we even managed to print them. Now, when I'm looking back, when I was looking at the things that would be crucial for me to say within this address, I remembered an old saying: may you, God forbid, if you are given the chance to learn what you can survive. But our generations did have this chance to learn that we really can survive a very difficult, very critical, and very perilous, risky period. I'm really proud of the entire healthcare system that managed to do it, and I was also part of this organizational story. We passed through the COVID-19 crisis, we overcame it. But it was very important to remain prepared for what might yet be there for us to face in the future. I cannot miss but mention something that we all know. Our healthcare system is not among the strongest and safest. But what was demonstrated in its rapid reorganization, the good results it showed, and assisted with all these instruments and tools provided to us by our partners, also technical equipment that was provided, means that we can stand shoulder to shoulder and tackle the biggest crisis that the world has faced. I cannot help but mention that in addition to personal protective equipment, a lot of other equipment was procured, technical equipment, oxygen concentrators, ventilators, also expendable material, masks, other tools such as medications, everything that was necessary for good care and treatment of patients with COVID-19. I can't help but mention that thanks to the WHO, we collected and published our clinical experiences through the Solidarity research. I cannot help but mention that those were the first recommended medications that we used. We received them at the Infectious Diseases Clinic. And of course, I could mention many other things. I looked at Dr. Bayraktarov. I remembered their support in the first days of the COVID pandemic, our support for us, the doctors. Although we are infectious diseases doctors, we know what it is like to provide treatment on the edge, to experience the risk yourself. Still, we faced a lot of fear, and the psychological support that our colleagues psychiatrists provided was immensely important. We can say much more, but I will stop here because I believe that the discussion will feature a lot more things.
Thank you so much. I know it's hard to conclude in very short remarks in this limited time that we have at our disposal, but we have to also bear in mind that we're running a little bit late of our agenda. Now I would like to give the floor to Professor Dr. Golubinka-Boszewska and talk about the work and the importance being done in strengthening laboratory capacities with a special focus on COVID-19. Dr. Golubinka, the floor is yours.
Благодаря.
Thank you. The COVID-19 pandemic has undoubtedly shown that one of the key segments with which one can assess the capacity of a country to respond to such a great pandemic like COVID-19 is notably the existence of a well-developed system of microbiological laboratories which function in accordance with the international principles for biological safety and quality. When dealing with a pathogen, a highly pathogen of high health importance, the microbiological labs are exactly those that are on the first line. First responders. It's their task to establish very quickly, timely, precise diagnostics of the pathogen that is circulating, but also to provide information about the characterization of the virus. Dr. Karadzowski mentioned we had all the variants of the COVID, of SARS-CoV-2, and to make it possible for people to know the ways of transmission of this virus and of maybe other pathogens that have come and will come in the future. Infectious diseases never stop, absolutely, and this is of utmost importance for all measures that need to be taken, not only for individual patients in terms of their individual treatment, but also in terms of timely and speedy measures to prevent to stop the spread of a disease, to contain it, and take further measures for further prevention and control of the given disease. I am satisfied that the Public Health Institute and the Department for Virology in the Institute, as a responsible institution in line with the legislation in our country, was the first institution to respond with regard to diagnostics of such highly pathogenic organisms. after we got information December 2019, beginning of January 2020 about the occurrences in China and the deciphering the virus with the new generations for sequencing, and the first scientific works on that with the support of the WHO, our laboratory immediately got reagents for timely response to this challenge. So on the 2nd of February, I exactly remember, we did verification of the tests in our laboratory. As you know, the first case was detected on the 26th of February 2020. For quite some time, our laboratory was the only one that responded to this challenge, but as numbers were growing, it became obvious that the number of laboratories needed to grow. So now we have 24 laboratories in the country which work on diagnostics, out of which 11 are public health laboratories dealing with diagnostics and response to COVID. What I'm really happy for, and that was a demonstration of high level of awareness by all partners, was to develop the minimal requirements for a laboratory to be dealing with such type of diagnostics. For the first time in Macedonia, we established such criteria upon insistence and at the proposal of the Institute of Public Health, but also the Ministry of Health and the Committee for Infectious Diseases accepted it as a positive characteristic, encompassing all the requirements to be fulfilled by a laboratory dealing with diagnostics of such a pathogen, space, offices, equipment, criteria for biosafety and biosecurity, which are of utmost importance when it comes to highly pathogenic organisms, all the way to medical waste management aspect. A really modern system and requirements that were established and that were accepted by both public health and private laboratories. This is a very big challenge indeed, and that's how we should continue to work in our country. After that, we immediately established the first SOPs in line with the WHO guidelines on sample taking, transportation, and we carried out the first training events at all centers for public health and all health points. WHO and the other partners remained our faithful partner throughout the whole pandemic, as it was already mentioned, and with the continuous support regarding the provision of reagents for detection of this pathogenic organism, for genetic characterization as well, not only for our laboratory, but for all public health laboratories in the country. And it was mentioned that WHO also helped with the provision of equipment, laboratory equipment, that increased the capacities in the country at all levels for timely diagnostic of this pathogenic organism, not just for molecular diagnostics, but also for biosafety and for what we call for primary containment in the laboratories, such as cabinets for biosafety and so on. I want to extend great appreciation for the support our institute got for genetic characterization, that is sequencing. We did have some capacities, and the first sequencing episodes happened with the equipment we had in the institute, but with the support we got in terms of equipment, we could do 48 instead of 24 samples, even 96 samples a week. Another thing I'm proud of, is that our country was the first one which in 2021, immediately after the first guidelines of the WHO were published on genetic characterization of SARS-CoV-2, we produced the first protocol for sequencing, even at level of Europe, for sequencing SARS-CoV-2 and other highly pathogenic agents. That was done by a national team. The workshops were with the support of the WHO, and the protocol was produced according to all the standards and measures for good laboratory practice. It was handed over to the Ministry for Adoption in November 2021, much earlier than all other countries which did it in 2022. It's very important that, in addition to strengthening the capacities for lab diagnostics, what's also important is to share fast the information from the laboratory with all stakeholders, such as epidemiologists or clinicians who need to treat their patients adequately. So the development of the lab information system was of extremely important and visible during COVID. With the support of WHO, we expanded this system for sharing information, first of all, to all epidemiological services, then to the GPs, then to the hospital doctors. And today, after being able to see the positive results of this lab info system, in September of this year, a team was created to work on the improvement of the lab info system for timely sharing of information for all pathogenic agents. And the system in the country has been assessed and recommendations have been formulated. This is all very good. We can have excellent equipment, we can have best reagents, but unless we have well-trained staff, not much would be possible. With the support of the WHO, we conducted many training events. I mentioned the first 10 training events, but there were additional training events on biosafety, biosecurity of more than 9 laboratories in the country, public health laboratories in the country. We also trained people to apply WHO tools for proper assessment of the cost of a test and the cost of functioning of a laboratory for 1 year period, as well as many other training events on sequencing. I know I exceeded my time, but this is extremely important. As a result of the development of the capacities in the Public Health Institute for Sequencing and the good evaluations from the international community about the quality of sequences we provide, WHO selected the virology department at the Institute of Public Health to be an education center for sequencing for the laboratories in the Balkan region. And in February of this year, we had the first international training in our center. Thank you very much.
Thank you so much, Dr. Boszewska. I'm sorry I have to interrupt, but we have to be mindful of the time. Now I would like to give the floor to Professor Dr. Stoyan Bayraktarov, talk a little bit about the mental health needs in times of COVID-19 and how these were tackled by the North Macedonian team. The floor is yours, Dr. Stoyan, please.
Thank you for the opportunity to present what we did as a country, as a healthcare system to respond to this crisis. And I will repeat that we also did it after the crisis, but for this we owe gratitude to international organizations such as WHO and USAID. I must say that as a professional, I was not puzzled by this. My opinion about the preparedness of system and human capacities was confirmed. No healthcare system could be adequate or sufficient unless it has the human capacities, as we heard from our colleagues. In terms of management, tracing the situation and the indicators, and directing the activities on addressing the challenges, but also on the clinical level. I must mention, because I was reminded of this by Dr. Stevanovic, of the extreme dedication, commitment of the healthcare staff, especially infectology clinic. We have excellent cooperation with them for years, and I can remember that this support began with our fight against this word stigma in the healthcare sector. It is most prominent regarding HIV patients and mental health patients. So probably as we shared the experiences in the past, this made us very close, and otherwise we also have some similarities in our work. In terms of mental health, from the beginning of the crisis, as you all mentioned, the WHO representative mentioned, we had the awareness that during the crisis, but especially after the pandemics of COVID-19 ends, there will be a mental health pandemic, a crisis of mental health, and we can see it happening. It will grow. The global experiences say that after economic crisis, after terrorist attacks, once the situation calms down, the mental health indicators deteriorate. And this is very clear because during the crisis, we are intensifying our psychological resilience mechanisms, but after they subside, we sort of give in. This happens with different indicators. This is a feature of every crisis. We're still within the crisis, but once it ends, because we still have economic military crisis, but once it ends, there will be deterioration of mental health, suicidal indicators. This is also happening in other countries, in Denmark, in all countries in the world. And there was also a research that we carried out with support of USAID in cooperation with the UNICEF about the impact of the pandemic on mental health of children, adolescents, their parents, and women in perinatal period. The results of this study, which will be published soon, and probably we will then develop a more in-depth analysis on the basis of them. They show that more than 30% of young people, adolescents, we can see indicators of depressive mood. For about 20 to 25% of adolescents, we can see self-harming thoughts. There is also a high increase of verbal violence in the family. The doctors report this, the patients report this. On the global level, there is 18% increase of serious depressive symptoms in women in perinatal period. And all of this is an alarm, is sounding an alarm for all countries in the world, primarily in Europe, I would say, to address this mental health crisis. WHO already in 2001 made a big step forward, and this will be part of the history of mental health institutions. It established a mental health coalition on a European level, which is aiming to collect all experiences on the European continent and to spread them through the countries, across the countries in the European region, in order to share the good practices, following the indicators, following the prevalence of mental disorders, especially in young population. Our country, our healthcare sector is taking certain steps. I would say that the key intervention, the support of the WHO We recently had a meeting of a coalition, especially in the countries of the region. They all sounded the same sentence. Many of the participants of the coalition uttered it, that perhaps what is most important in directing our efforts, if nothing else, then the word of the WHO, the voice of the WHO that is highly respected in the region and across the world. So the two crucial interventions that we did within the support provided by WHO and USAID aimed at increasing the capacities of the system, primarily of the healthcare staff, because we know that the first level that is facing the situation is the primary healthcare, and the WHO has, in my modest opinion, one of the best materials I have ever seen, educational materials, because I'm a professor at the Faculty of Medicine and I have close contact with educational materials, but the MHGAP is supreme material to increase the knowledge and to improve the practice in primary health care on combating mental disorder at several levels for all the most important groups of diseases. I believe that we carried out a training of trainers, education, regional centers in Kocani, Kevgelia, and I believe that in discussion of WHO on a European level, this is something that we must do in Macedonia. And the second crucial activity, key activity, we have a mental health system. 2 more sentences and I will be very brief. This mental health system was also constructed together with the WHO 20 years ago. It is crucial to address the mental health of population. We created an action plan on revitalizing the centers, how to restore the priority, reintroduce the priority on mental health for the ministry, because we know that for every ministry in the world, situations that appear more medical, in parentheses, seem more important. They receive more attention, more finances, but we created a serious working protocol that is standardized. And especially during the crisis, we managed, as I said, by involving the healthcare personnel in Kocani. We opened a new center for mental health, and again, appreciation to WHO and USAID. Thank you.
Thank you very much to Dr. Bayraktarov and also the rest of the distinguished members of the panel for their discussions, inputs and key insights on how the COVID-19 emergency was managed in North Macedonia and more inputs on that. Now I would like to open the floor for discussion and questions by the audience. We have around like 10 minutes to talk about issues, questions or inputs that members of the distinguished audience would like to pose to our panel members, please.
There is a question.
Please, the microphone to the lady in the back.
Добър ден на сите от мене.
Hello, everybody. I'm Dr. Partalovska. I'm a child adolescent psychiatrist at the Clinic for Psychiatry. Thank you. I would like to thank all the presenters. As you can guess, I'm worried about the mental health of children and adolescents. We have noticed significant deterioration of it due to the COVID-19 pandemic. My question is to Dr. Bayraktarov, but also to WHO members as promoters of changes in the country. Do we have a strategy or a plan for our country to improve the mental health of children and adolescents, especially in such crisis periods? Thank you very much. Thank you for your question. I think that the ministry is giving a lot of thought, because the first priority in the national health strategy is exactly mental health of children and adolescents improvement. I would say regarding this issue that WHO, but the overall UN system in the country as well, to the best of my knowledge, developed a strategy to prioritize the child and mental health next year. Of course, we need to make an analysis of the system. We know that we lack a lot of services in this area. We have only three services that need to be improved. We have strengthened our department at the clinic a lot, but I think we need an action plan, and we have announcement that will be supported in doing that. Good day on my behalf. Closely related question to the previous one. I'm Ivo Kunovski, clinical psychologist, also from the Clinic of Psychiatry. Dr. Bayraktarov mentioned about community mental health, and we know that in the past years this has been getting more and more importance globally, and I have witnessed myself significant efforts to improve the community mental health services. So I would like to hear from Dr. Bayraktarov about our capacities in terms of community mental health and what you think should be improved in that regard, in regard of the community mental health. If we are talking about human capacities, I would mention that we got significant support from the Minister of Health during the crisis, from Dr. Filipce, and we strengthened significantly the capacities. We hired a lot of young professionals for psychiatry, for psychology, and this was of great importance. Regarding other capacities, other than human capacities, we have great needs for support regarding institutions and activities. There has been obviously a fall in the period between 2010 and 2018 vis-a-vis the period before that and the activities by WHO. We need community mental health centers in other municipalities in Macedonia at national level. We also have to have an action plan, and we have to have a whole of government approach, including the Ministry of Finance, because we need new hires and so on. So this is of great importance, the whole of government approach. We remember in this conference room, under the Stability Pact for Southeast Europe, all countries signed up for promoting mental health services. I think that was for the period 2000-2010, and I think now it's high time that we did more about it.
Thank you so much, Dr. Bayraktarov. I would open the floor to one more question, please.
Can I?
Yep.
Добър ден.
Good morning to all panelists and everyone here. I'm Dr. Osmani from the Public Health Institute. I will make 3 questions to Dr. Zarko. After you established the Public Health Emergency Center, do you have good staffing levels? And do you think that you have sufficient staff, considering that most of them will need to also work elsewhere? To be brief, is there a strategy or a long-term plan so that the state recognizes finally public health as one of the most important action plans in a country? To Dr. Milena, a question. COVID was an experiment, so to say. You cannot learn about it from books. Do you think that if another COVID would happen now, Would the state, other than the infectious diseases clinic, would the state be able to manage it? Other than concentrating it within one facility, are we able to manage a similar crisis? And to Dr. Bayraktarov, you said that you have indicators that family violence has increased as a post-COVID phenomenon. You mentioned this. Have you done such studies before? Because the lockdown brought everyone together. Probably the husband and wife would see each other probably once in 15 days, but the lockdown brought them together constantly. Do you have a previous study so that you could compare the conclusions? Thank you.
Before taking the answers, I would like to remind that there's only 5 minutes remaining before we go to the next item on the agenda. Please, Dr.
Во неколку реченици.
In few words, we gave a pointer to the country what it needs to do to strengthen the healthcare system in the country is a task for the Ministry of Health and Public Health Institute. There are two options. You asked me about the staff. The director of the Public Health Institute should create the systematization, the organizational structure. Usually such centers are within the public health centers or institutes. The Minister of Health of the country, if it wishes to finance it, this is what they need to do, because this is how it's done around the world. We established it as it is now. We need to continue. The director of the Public Health Institute, on the basis of the staff available, makes this decision. My assessment is that it is sufficient at the moment. It was sufficient during the time of the peaks of the crisis. We managed 2,000 cases per day. But if we would have 1 or 2 or 3 epidemics at the moment, if we would need to work on several fronts, we need to think of staff, equipment, space, reagents, and most importantly, human potential. What is most important, in my view, is the human potential. I'm the oldest one in this institute. I think that I will soon end my working career, but if we do not engage young forces that can take over the legacy in activities, it would be stupid if we do not manage to continue something that we place the foundations for. Space, equipment, staff, and the director needs to decide whether it is within the epidemiology or whether it is a new center. Hello, everyone. I was listening attentively about all problems, experiences, and challenges that we went through in the COVID crisis that is still active. I have just returned to a visit to SCDC Stockholm. A topic for discussion, in addition to others, was emergency operating room. They do not call it a center. They should be established. It was a meeting between the Western Balkans and Turkey to establish operating emergency centers at the level of Western Balkans and Turkey. We were prepared for us. It was very good. I participated in the discussion. I mentioned that in cooperation with the WHO and USAID, we have already started this. I indicated that during the crisis we had a pilot center, and it demonstrated its effectiveness through its results. And now I mentioned once again, in cooperation with the USAID, with the WHO, we need to introduce all norms applicable to have it as a part of the Public Health Institute, of course with continued support from the WHO, USAID, and the Ministry of Health. The other aspects, staff. At the moment, we have only epidemiology and microbiology, but in the future, we want to also manage radiological crisis and chemical disasters recovery. So we're starting with what we have now, but it should be a center within the Public Health Institute. And whether it is under the ministry, the norms are not a problem. We have started following this model and we will continue strengthening the capacities. I believe that the Public Health Institute should introduce all changes to the systematization, to the organizational structure, so that we can incorporate it administratively within the structure. We are still waiting for some approvals from Ministry of Justice about the staffing levels and everything we need to do with the assistance of Ministry of Health. This is a new development where the European Centre for Disease Control is already beginning the procedure of establishing emergency rooms in other countries. Thank you. If I may respond briefly, yes. The research was carried out comparatively against the results of a similar study with the same tools from before the COVID crisis. So yes, the difference is quite obvious and the research will be published soon. I also have a response. Yes, colleague Osmani, I think that we will be able to deal with the same or similar situation, but whether we need to be better, of course we have to be better, and in order to be better, the lessons of the mistakes we made in the past period, the lessons regarding planning primarily, must be learned and must be implemented. I agree with Dr. Karajovsky. Human resources are the main shortage. And of course, it is an obligation of the state, of the health policies, to plan adequately for human resources. And what is planned must be respected, must be implemented so that we can really have quality healthcare system in regular conditions that we wish for, but also in crisis circumstances, and we cannot forecast the crisis.
Thank you so much. Despite running a little bit behind schedule, I'm also very glad that this event is also contributing to a lively discussion in taking stock of all the response from the North Macedonian public health authorities, of course with the support of WHO and with the generous financial assistance from USAID and other partners. This is very, very interesting to learn. I would like to come up with some key takeaways from the panel one before we move to the next item on the agenda. So it's really interesting what Professor Dr. Karajovsky said, that we need to be prepared and like the assessment of the surveillance system, how it helped with building up the response, because as he rightly said, health cannot wait. But in order to be prepared for health cannot wait, we have to, as Dr. Stefanovic said, remain prepared. And for that, it's not just a matter of making sure that we provide for the PPEs and the supplies and the right technical equipment. And I would also like to follow up on what Dr. Ann said. It's most importantly that we are building capacities, we are building know-how, and we are developing skills so that we can be really prepared and ready for the next emergency. It's also very important to refer to what Dr. Golubinka said in terms of the amazing work that the North Macedonian authorities have done with building up what she said, the 24 labs, and 11 of them being the public health laboratories, which helped tremendously with identifying the viruses and all their helping with the surveillance efforts, which was of crucial importance during the pandemic. And last but not least, I would also like to commend Dr. Bayraktarov's efforts in terms of dealing what he rightly referred to as the crisis of mental health. This is like a really key insight and takeaways that we need to really take stock of our pandemic response and make sure that we are prepared and we are doing the right thing in tackling mental health issues, which are very, very important. So thank you very much. Really appreciate for all your insights. Thank you. Thank you. Thank you.
Им благодариме на
I would like to thank the moderator and the panelists for the fruitful discussion, and also to all of you who engaged with your questions and comments.
Пред да продолжиме со вториот панел на денес.
Before we continue with the second panel, I propose to watch another video on the activities for support to vaccination against the COVID-19 and routine vaccination as an introduction to the topic that follows.
На сите граѓани, мушко или женско, нек се вакцинират. Тоа ќе помага многу за здравје.
Се наоѓаме на еден од пунктовите за теренска вакцинација, кој што е континуитет во однос на вакцинацијата која што е почната веќе година дена. Тука се обалува пунктов со цел да бидеме поблиску до граѓаните и тие што не примиле прва, втора, евентуално и трета доза може да си примат на различни пунктови кои што се во организација на Министерството на здравство.
Со оваа акција сакаме да покажеме дека сме како држава и како министерство многу заинтересирани да приближиме вакцинални пунктови до сите граѓани на земјата. Тоа значи дека се уште продолжуваме со акциите за промоција на вакцинацијата како начин на сигурна имунизација на сите граѓани.
With this caravan, we're reaching out to people who live in remote or underserved areas to ensure that they have easy access to vaccines.
Јас чекав термин да ми дојде за да се вакцина, ама поминувајќи вамо, викам ајде да види што е овој и реши да се вакцинирам трета доза.
Одбрав да дојдам вакциналниот пункт, зашто поблиску им беше поудобно за вакцинирање.
Затоа што ми е наотворено и безбедно е за мене.
Навистина е од големо значење да се допре до потребите и до приоритетите на заедницата на локално ниво, да се оди од куќа во куќа, кој што нашите теренци буквално ја искористија таа можност во рамките на оваа активност.
It's been proven that the vaccinations reduce the effects of COVID when we get them. We can protect ourselves, our families, but also our communities. And I think this is where the pandemic has really been a test to us as a world, where until we are all free, none of us are free.
Ја би порачав да се вакцинират сите граѓани што се, да се штитат. Па ја мислам дека е важно за нашето здравје.
Kemi përgatitur broshura me fakte rreth vaksinimit kundër COVID-19, maska, mjete për dezinfektim dhe burime tjera kyçe. Është shumë e rëndësishme të vazhdojmë të përmbahemi masa parandaluese për të cilat ne e dimë që janë efektive.
Па би препорачал за нивното здравје и за здравјето на сите околу нас да се чувствуваме по-безбедно и по-здраво за да се вакцинираат.
Apelojmë tek të gjithë qytetarët të mos mendojnë për efektet anësore të vaksinës, por të vinë sa më shpejt të vaksinohen, të pranojnë dozën e parë, të dytë dhe të tretë, në këtë mënyrë të bëjnë këtë të mirë për shëndetin e tyre dhe shëndetin e njerëzve të tyre më të afërt. Vetëm kështu mund të kalojmë pandeminë dhe të mbrojmë njerëzit tanë.
Finding, actually, the discovery of vaccines was one of the biggest breakthroughs in history. Many diseases are now rare or inexistent as a result of the scientific breakthrough of vaccines. these invisible monsters that have killed so many people were finally beaten and defeated. Despite these facts, some people are still resistant to vaccinations, even among health workers. Last year, we were witnesses of especially designed activities to train medical professionals about new knowledge and skills for vaccination for a greater good, the health of the overall population. Now follows the second panel discussion on strengthening immunization against COVID-19 through capacity building, digitalization, and dealing with population hesitancy. We invite Mr. Tanas Goga again as a moderator and the panelists. Professor Dr. Alexandra Grozdanova, President of the Committee for Immunization in the Ministry of Health. Professor Dr. Katarina Stavric, President of the Center for Family Medicine at the Faculty of Medicine in Skopje. Professor Dr. Elena Chosevska from the Public Health Institute, focal point of WHO on behavioral studies, and Dr. Dragan Jankovic, expert of WHO in the WHO Regional Office for Europe.
With the second panel, with old and new friends and distinguished members that I have the honor and the pleasure to re-meet again. We're going to talk about strengthening COVID-19 immunization through capacity building, digitalization, and addressing hesitancy. As we all know, the goal of the USAID-supported WHO project for strengthening COVID-19 vaccination was to support and ensure greater coverage, uptake, and also safe deployment of the COVID-19 vaccination in North Macedonia. As part of the current efforts to raise local awareness about the value of COVID-19 immunization, health workers worked oftenly with UN partners, local NGOs, and of course national health authorities to improve the quality of the immunization services. And in so doing, they implemented various activities to strengthen national capacities, to raise awareness about the importance of vaccination, both among the healthcare workers and also the population at large. As we also know, WHO studies show that giving evidence-based information, also tools and resources to healthcare workers about COVID-19 vaccination, provide them with means and confidence to be more efficient in the work and to help achieve a higher level of vaccination. So in today's discussion with our panelists, we'll present the implemented activities and their outcomes. And for that, I would like to start with Professor Dr. Alexandra Grozdanova to talk about the experience and lessons learned from the implementation of the National Deployment and Vaccination Plan for COVID-19 in North Macedonia. Please, the floor is yours. Go.
Thank you.
Go ahead.
Good day, everybody. Thank you for the invitation to participate as a panelist in this second part of today's meeting. I would like to thank WHO as a supporter and USAID for this opportunity to say everything that has been done in this part. I listened carefully the previous panelists, and through the video footages of the caravan, it all came back to me. Many activities that are behind us. I'll start by saying that the COVID vaccination in our country so far has been the most massive medical intervention, which began on the 17th of February 2021, and until today 1.8 million plus doses of COVID vaccines have been administered in North Macedonia. This is a very serious number. And it means we have lived up to the expectations and to the needs of the tasks. In the first 3 months, We were among the last countries in the region that got the vaccines. We are under heavy pressure by the public, but also pressure that we felt as health professionals. Luckily enough, we went through that period quickly, because from February 2021, we started the vaccination process. Before that, we made all the preparations, like the national plan, which was finished at the end of 2020. Why? Because our country, in principle, we expected that we would face one of the greatest logistical challenges. The number I mentioned of 1.8 million doses plus, we couldn't foresee it at that moment, but we knew that our country at that time was not ready for mass-scale immunization. We had the national plan for COVID-19. What was done firstly were the priorities and the logistical approach. Our colleagues from the vaccination points were to deliver the vaccines. The first step we did was a huge number of trainings. January, February, March were the months when we educated and training our colleagues. Even though administering a vaccine as a medical intervention is not a complex thing, but this was a new vaccine, and all that was new for us. Additionally, we as a country were faced with a situation of not having enough capacities for storage and distribution. I must mention that regular immunization takes place according to a different principle, where the government does not have its own storage capacity. That was a second challenge. Thanks to WHO and the other partners, we managed to solve this issue. The COVID vaccines requested special conditions for storage, such as fridges of -70. At that time, the whole world wanted such fridges, and huge thanks for that, because no matter how ready you are, logistics is everything in those moments. It makes the difference between success and failure. There was another recommendation by WHO that routine immunization shall not stop at any moment. The first recommendation of the Committee for Infectious Diseases and of the Committee for Immunization is that no vaccination point for regular immunization shall be closed, and it was like that. Although we must be aware that the regular immunization did suffer from some drop in the rate, in the coverage rate. We embraced all donations, and at that time we had vaccines for the other diseases, which was not everywhere the case in the region of the Balkans. We had all the vaccines, and the process of regular vaccination, at least in terms of availability of the vaccines, was perfectly okay. The second challenge was about the distribution. You remember we started with the first vaccines donated by Serbia, 8,800 Pfizer vaccines administered at the modular hospital at the infectious diseases clinic. From this perspective, it may seem simple, but it was not simple at all. You can take my word for that. Many capacities, like Malmet, the agency for medicines, was very flexible and cooperative in this regard. Every drug must be endorsed nationally. And with all the challenges, we fought with all these regulatory challenges. Then training started. I participated in drafting most of the materials. I remember the vaccination teams were exhausted with trainings, because with every vaccine we needed to train them. For every vaccine they needed to know how to operate the cold chain. During the summer we opened the mass scale vaccination points like the sports arena, Boris Trajkovsky and other sports arenas, and we at one time had an impressive number of 20,000 plus vaccines administered a day, which is a great challenge. During all this time we trained family doctors, the GPs. The WHO helped us to train the human capacities. Even though the COVID was a new disease and the new vaccines were new, and we had to train the doctors, the GPs, the chosen doctors. We had more than 100 for sure workshops. Dr. Stavric will remember also the trainings for family doctors, for the chosen doctors, the SOPs that were produced. I'm a professor at the pharmaceutical faculty. We could realize that maybe the lack of human resources to promote the COVID vaccines showed some gaps, so we trained more than 200 pharmacists to deal with disinformation, with fake news, and so on. I must say also, I'll finish by saying that the biggest investments happened in both segments, in the logistical, distribution, process, storage, but investments in human resources. Luckily enough, now we have much more prepared human resources, educated doctors at different levels in different areas to cope with similar situations in the future.
Vrzanova, thank you very much for your insights and inputs. Now I would like to move on to Professor Dr. Katarina Stavric and talk about the capacity building and continuous medical education for empowering the frontline immunization workers and also immunization managers to promote and transmit state-of-the-art vaccination practices. Please, the floor is yours.
Thank you. Thank you for having me as a participant in this panel discussion. And I must say, my gratitude goes to the WHO and USAID, who understood the importance of education of healthcare staff. But what I'm particularly proud of is that this project really gave rise to new guidelines as updated standard operative procedures. I have them with me now. And that in the recent meeting with the directors of medical institutions and heads of preventive teams, these written materials were made available to every prevention team in an immunization facility. So everything that we did in the past 3 years through education of the entire healthcare staff involved in immunization and also general practitioners, family doctors. They were trained, most of them, for COVID vaccinations. The written materials are made available to healthcare workers, and at every moment they could have access to them. We're hoping that an electronic version will be made available also to a broader circle. These materials were produced by experts, members of the National Immunization Commission, in cooperation with healthcare workers who work in the field, on the ground, in practice, because it is important that this is functional, that this is implementable in practice. My gratitude goes to them. Also, within this project, we created a network of educators, regional educators and coordinators, with the purpose of strengthening cooperation and continuing education on the regional level. education of healthcare staff working in the area of immunization. What else can I say? We continue. As a professor of the medicine faculty, I'm more than aware that ongoing education is crucial in order to maintain the system that we managed to build during this period. And of course, we are facing a challenge of increasing the reach, the catchment of immunization, not only the routine immunization for children, but also COVID vaccination should continue so that we can save lives. Everyone who is vaccinated is a life saved. And I believe we will continue working together in order to achieve the catchment that we used to have, 95%.
Thank you so much, Professor Dr. Stavric. Right on time. So, I would like now to proceed with Professor Dr. Elena Kiosewska to talk about the importance of the behavioral and cultural insights in creating evidence-based interventions in the COVID-19 response. Please, the floor is yours, Dr. Kiosewska.
Thank you for your question. Vaccination against COVID-19 was, is, and probably will be a challenge because it started in different circumstances with different challenges compared to vaccination for other communicable diseases. Convincing people that the virus is really dangerous to health, that it is necessary to receive the vaccine, is still a challenge for all of us. We know that as humans, we have some convictions on ways to safeguard and to promote, improve our health, and about the factors that would impact our health adversely or positively. And not only our health, but the health of everyone around us. But we are also aware that there is a broad spectrum of factors that have an impact on the decisions related to health. These are the factors stemming from the education levels, culture, traditions, knowledge, convictions, and beliefs. The activities taken thus far demonstrated that different approaches are successful in different communities, and therefore it is necessary to have an individualized approach to the needs of the local population. Behavioral researches or studies are of outstanding importance. And why? Because they have the aim of having all activities that are undertaken based on evidence, on actual situation. And they have the aim of implementing activities that will meet the needs of population or of certain groups of population. As we all know, there are two types of such researches that are investigating perceptions, knowledge, attitudes, and beliefs, namely quantitative and qualitative studies. With the support of WHO and the USAID in our country, we undertook both quantitative and qualitative researches. Also, huge support to the researches was provided by our institutions. Huge gratitude to the Institute for Epidemiology and Biostatistics, Professor Vesna Velic, and also the team of the Team Institute, who assisted us the colleagues from Public Health Institute in creating and conducting researches with the population, quantitative researches, but also with the healthcare professionals. The usefulness of behavioral studies lies in the fact that the results led to the next steps to be established in order to lower the resistance of the population towards immunization in general, but also COVID-19 vaccination specifically. And the results led to successes, namely, we had the caravan that made rounds of rural communities, which led to increased coverage of population with vaccines. There were also trainings for the healthcare workers in order to increase their knowledge and skills levels related to immunization in general and COVID-19 vaccination specifically. Cooperation was established with women leaders who helped raise the awareness of citizens about the need of vaccination. And also, another very important activity was improving the capacities for analysis, for statistical processing of data stemming from the behavioral researches. So I will say again, with the assistance of the TEAM Institute, team trainings were organized on methodology of behavioral researches, but also with the assistance of a German institute and the university to work on statistical processing of data. So the significance of behavioral studies is self-evident, and this has an impact on the population and healthcare workers, and we are hoping that we will continue enjoying the support of the WHO and USAID so that this process would continue. Thank you.
Thank you so much, Professor Dr. Kioszewska. It was really interesting to listen and hear about the BI insights and all the efforts that you have been doing so far. Now I would like to give the floor to Dr. Dragan Jakovic and give us a little bit of perspective on the regional and sub-regional approach to COVID-19 vaccination.
Well, thank you, and thank you for having opportunity to address this meeting. The COVID pandemic is many times recognized as unprecedented situation, and it's similar from the point of view of vaccination. In the period less than 1 year, you have a developed vaccine to respond to new pathogen. That was never happening before. Then we can say that in the period of next 3 to 4 months, majority of countries in our region start using vaccine. Again, introduction of new vaccine, new capacities, new trainers, new trainings, new people involved, new mechanisms and platforms how to do it. It's something that was never done before. And then we also have the situation that global cooperation and partnership like COVAX was established to provide kind of equity, equality in approach and distribution of vaccine. Next segment is that a new variant, the new dominating variant of concern was appeared something like a year ago, and then the next variant of the vaccine, bivalent vaccine, was developed in the less than 6 months. So those are all examples how the technology and vaccination program was responding unprecedentedly to unprecedented situation of pandemic. And one of the things that we have to stress and underline is partnership on the global level among all interested parties in the health area, But considering that the pandemic was not only affecting the health sector, but also all other segments of life, there was involvement of new partners and unusual partners to deal with the situation in the countries. And the level of the country, we were appreciating presence of such partners as USAID, because again, if you look European region, USAID was mostly involved in activities to respond to eventual importation of polio and keeping the polio-free status. However, in the moment when they recognized the challenge that COVID pandemic presents to the region, they address and support countries directly with the new ideas and new resources that actually we need in this area. The second issue is also that in our region, traditionally middle-income countries, where North Macedonia belongs, are not well recognized, both by international organizations and by partners. And that's a big challenge that we are trying to deal with for the immunization program in general, because the issue is that countries do have technical capacity to address some of the problems. However, there is not sufficient resources and financial and political commitment to deal with that, and there is a clear need to intervene in this area. So to finalize, all together experience of COVID-19 is fantastic for immunization program. Stepping back, a response to COVID was mainly based in the area of immunization capacity for routine immunization in the country, and there was a great switch and twist of all activities that everything is invested to respond to pandemic. Now it's time to take it back. I mean, we are hoping that pandemic is going in the right direction to be finished soon, but all these capacities that we build, that you build in the country, should be maintained and kept and implemented both for the eventual pandemic of other diseases in future, continuous response to COVID until it's finished, influenza immunization and pneumococcal immunization for adults, and most than everything, immunization of the kids, because routine immunization was suffering during the pandemic time, and some of the countries of this sub-region especially are most affected. So that's what and how we need future cooperation between WHO and countries with present support of the partners, because we will still need them to help us in finding resources, in helping implementing these lessons learned, but also building further what is needed for Immunization Agenda 2030 that we are trying to implement in the region. Thank you.
Thank you so much for your discussion, Dr. Jankovic. Really, really important, the idea of taking it back, so we're all looking forward. Now I would like to open the floor for discussions, and if questions are coming from the audience. There's two hands raised, one here on the right-hand side and the other one on the back. So let's start first with the lady on the back.
Dobar den na site.
Hello everybody, I'm Sanja Sazdovska from the Ministry of Health. First of all, greetings on this event, and greetings and congratulations to all of us who are here who made a contribution to write history in the Macedonian health sector, which is coping with the COVID-19 pandemic. Why am I here? During the COVID-19 pandemic, I was a regional coordinator for Ohrid region. At that time, we were faced with many challenges. Now we are in a recovery phase to see the lessons learned. I have a question for the President of the National Committee on Immunization, Professor Grozdanova. Yes, we were faced with the challenges. Please tell me the three most important lessons learned from this crisis, from the COVID vaccination. Three most important lessons learned in your view, and I'm sure they're based on evidence, on medicine, based on evidence-based medicine. Thank you. Thank you for your question. I tried through my input to mention them. First of all, supply of vaccines. We had 3 or 4 difficult months, which were very difficult, even in our neighborhood. Citizens were vaccinated and our citizens did not have access to vaccines. So this gap of 3 to 4 months. In the past, even with regular immunizations, there were such gaps, but they were very short. They lasted for a very short time. And they were due to some legislative changes and regulatory changes. But that problem was not that big. So with regard to the supply of vaccines, we have to bear another thing in mind. We once got vaccines that at one time were not approved by WHO or by the European Medical Agency. This was the Sputnik vaccine. We showed great flexibility there. It showed that intersectoral cooperation there is very important. And we have that on a daily basis. So my first lesson learned is continuous supply and constant availability of vaccines. We were discussing with Dr. Dragan at a regional meeting that maybe we need now regional supply, because the problem of Macedonia as a small market is that not always the partners from the other side, these are the manufacturers, they don't see interest in a small market like Macedonia. That's one shortcoming when you're a small country. Another issue was logistics. Much of it was resolved. We have to have a national depot, national storage capacities, and distribution. I have to acknowledge greatly everybody from the transfusiology, from the Ministry of Health, who did a great job at the time of the pandemic. Those are superhuman efforts they put in at that time to provide room, first of all, where to store the vaccines, and we didn't have such capacities until then. I know that only we had 5 refrigerators at -70, and they were in the scientific institutions. So, timely logistics arrangements, and thirdly, serious investments in human capacities. Not about medical application of vaccines, medical administration of vaccines, more into evidence-based medicine, having more trust in science, having more trust in vaccines, because as Professor Josefska said, we still have divided positions even among health workers. So these would be the 3 lessons learned that I think we learned during this period. Thank you.
I think this was quite an exhaustive answer to the question posed to Professor Dr. Grozdanova. I would like to give the floor to the question on the lady on the right hand back. Yeah, thank you.
Good afternoon. I'm Dr. Atanasovska, specialist in labor medicine. I come from the Institute for Labor Medicine. Congratulations on the event. And I feel the need to share the activities that the Labor Medicine Institute had within this Occupational Medicine Institute had within these activities. In cooperation with the WHO, Ministry of Health and USAID, we organized 10 online workshops involving healthcare workers from the vaccination sports vaccination centers, and the Institute made its contribution by promoting the principles of health and safety at work for these workers, occupational safety, and also extended gratitude for their enormous workload and fatigue during the COVID pandemic, but also engaged in physical presence workshops for a group of workers promoting the advantages and benefits of COVID vaccination. The activities ended, but there was a need to organize 10 additional workshops with healthcare workers around the country to promote the vaccination of healthcare workers and vaccination in general, not only against COVID-19, but also vaccination against other communicable diseases. I would like to extend the gratitude of appreciation of the entire team of the Institute to WHO, Ministry of Health and USAID for the involvement of our institute in these project activities. Thank you.
Thank you very much for the contribution. I think we have a question from the director here at the front seat. Yep.
Yes.
I have a question for Professor Grozdanova. It is not the problem about vaccinations to regular calendar and COVID. What about the vaccines that our citizens need to take before traveling to third countries to Africa? And such vaccines are missing for 2 years. I have communicated with the ministry. Our citizens are buying these vaccines in Belgrade and Pristina. As a National Immunization Committee, I don't think that it would be too big a deal to ensure 50 vaccines against yellow fever. The state needs to procure them. You are not a policy maker. You are a member of a national committee. It is in this capacity that I'm asking you to respond. Thank you for calling on me, and I will give you the answer. The vaccines from the regular calendar are responsibility of Ministry of Health. But those that are under epidemiological indication are the responsibility of Centers for Public Health. So you should ask this question of the directors. We have asked this several times. We must know who has the responsibility for what. We travel, we ourselves also travel. We have friends who are asking us about this. And I agree that this is not the right solution, that it has to be tackled. We spoke even with the producers. We called them, but even when the tender was published, they did not respond because we are procuring very small quantities. This is why we raised the initiative to make a regional order, regional procurement in order to increase the quantities and availabilities. But I'm now urging on the Centers for Public Health, where this process of vaccination is taking place. They have the responsibility of carrying out these procurements. Ministry of Health, as a body procuring the vaccines from the regular immunization, is even reimbursing costs, because every year some of the vaccines for hepatitis B, unfortunately for a full year, nobody is applying to the tender that was published. I'm speaking about the practical aspects so that we know where the problems lie. The problem is not with the National Immunization Commission. From day one, we communicated the weaknesses of the system we have detected. Unfortunately, this problem is not resolved by those who are responsible for it. So I'm urging you to sit down and discuss the solutions that we could then propose to the ministry. According to the rule book, according to legislation, responsibility for epidemiological indication vaccines is with the Centers for Public Health.
For the question, thank you very much. Also, Professor Grozdanova, for your answer. If there's no further questions or discussions, I would like to proceed with some key takeaways that we had from the second panel. So, given the lively discussions and the insightful questions and answers that went on, it's really telling and illustrative fact of how challenging COVID-19 and the other ongoing emergencies have been for the public health authorities, and how much work still lies ahead of us in terms of making sure that we remain prepared and we take all the precautionary measures for emergency and preparedness and response. Some of the key takeaways that I got from the discussion, especially from Professor Grozdanova, when she talked about like how incredible mark of this 1.8 million vaccine doses came into fruition when nobody was really actually well prepared for mass vaccination efforts, and what kind of challenges they had to go through with distribution, with deployment, and also the training and the logistics of all this enterprise. And then how important was the establishment of the network of regional educators that Dr. Katarina Stavric so insightfully elaborated on, and how important it is for the healthcare workers and their important role in tackling the pandemic. And of course, Professor Kosiewska talked about the CBI, or the Behavioral Insights research studies, which were like very important for designing the response to the pandemic. And I have to admit, being a testimony at firsthand, that this was, North Macedonia was one of the first countries to embrace the Behavioral Insights study, and which is now being replicated in the rest of the Western Balkan countries. And it was quite a successful experience, both on the quantitative and also qualitative part of it. Last but not least, Professor Dr. Jakovic talking about the importance of partnerships and on the need that we now need to take it back. So it's about time that we think of redesigning the immunization efforts and how to scale it back and make sure that we are well prepared. And very important point made on the challenges that countries like North Macedonia and the rest of the Western Balkan countries are not well recognized, despite having the human resources and the capacities to tackle it. And I couldn't agree with him more in terms of the resources needed, and also the political will that needs to be at stake, and so that we are well prepared for the next emergency. I would actually like to conclude this panel discussion. But what I think the key message of our regional director, Dr. Hans, makes a point in the 72nd Regional Committee, when he talked about the new normal. In this time of ever rising health crisis and political and also economical turmoil, he made a point saying that we have to accept and work within this reality of a new normal. And this requires what he called the dual track approach to health. And by dual track, he meant that first, we need to invest in preparedness for like what is the mounting and often overlapping emergencies that we are facing through. And secondly, we must ensure that we maintain and strengthen the day-to-day essential health services. So we need equal emphasis on this prioritization of both a dual track approach for the new normal. This is one of the actually key learned lessons from COVID-19. And with that, I would really like to thank the panelists for their contribution and insights, and also the distinguished members of the audience for such a very lively and interesting discussion. Thank you so much.
Once again, we thank the moderator, the panelists, everyone who engaged in the discussion with questions and answers. And now we're inviting you to watch the short video which will wrap up today's program. And it shows the activities implemented with the support of Pion Association to involve women leaders from rural areas to increase the awareness about the importance of vaccination, with special emphasis on COVID-19 vaccination. Let's see it together.
На почетокот организиравме работилница каде жените вакцинални амбасадорки, лидерки во заедниците, научија за важноста на рутината и за COVID-19 имунизацијата, како и за методите за комуникација со членовите на нивните заедници, се со цел да им помогнат полесно да го разберат бенефитот од вакцинацијата.
Од експертите од Институтот за јавно здравје научив многу информации во врска со вакцините. Токму овие информации ги споделувам на социјалните медиуми и на моите пријатели, за да ги поттикнам да се вакцинираат и да ставиме крај на пандемијата со COVID-19.
informacion të ri unë e shpërndaja me shoqërinë dhe me kolegët. Prej kur u vaksinova dhe nuk pata asnjë efekt negativ, këtë eksperiencë e shpërndajta me të afërmit e mi, që edhe ata të ndikohen pozitivisht dhe të mund të shkojnë në punktet shëndetësore të vaksinimit në komunën e Bukovinës.
U vaksinuam sa po arriti vaksina. I shfrytëzova të gjitha kanalet e komunikimit që ta ndaj përvojën time dhe të familjes time dhe në atë mënyrë të motivoj të tjerët të vaksinojnë që të mbrojë në veçanti të moshuarit dhe të sëmurët kronik në për familje.
Успев да убедам ќерка ми, која беше скептична, а и незините блиски, дека ќе се заштитиме само ако се вакцинираме и ги следиме насоките на надлежните институции.
Споделувањето на информации базирано на факти за COVID-19 им помага на луѓето да носат одлуки за собственото здравје. Соработката со жените лидерки е одличен пристап за едукација на населението за полесно да носат одлуки за вакцинација. Општините со повисок процент на вакцинирани лица од COVID-19 се подобро заштитени, подобро подготвени и се многу побезбедни.
Почитувани присутни,
Dear participants, the speakers and the panelists shared with us the key results of the projects implemented, the most important stakeholders of healthcare system, with the support from our partner, will continue investigating the opportunities to implement conclusions from today's event by ongoing upgrade of capacities of healthcare workers and also continuing the communication activities using new strategies to reach out to the most vulnerable and marginalized communities and every individual in the country. The losses from COVID-19 will be engraved in world's memory for a long time to come. But the pandemic also made it possible for the society to see the outstanding importance of the healthcare sector and the need to strengthen the relations with other sectors and especially with the economy and education. And let's not forget, it created a link, a connection between all citizens of the world. Solidarity is the crucial dimension of future societies. No one must be left behind. Leave no one behind. It's not just a motto, it is our collective duty. We thank all of you once again for your presence in today's event, and we invite you to see the exhibition of photographs here in the room and then to join us in a cocktail lunch in the hotel's garden near the tennis courts.